कतिखेर आउँछौ भनेर खोइ कतिजना 75 भयो स्टार्ट गरौँ Okay, today we'll be discussing about rickets and osteomalacia. And these are the disorders of matrix mineralization. Okay. There is the abnormalities in vitamin D metabolism as well as accompanied by phosphate deficiency. So what happens is that in this disorder of mineralization, we'll be studying two topics. One is the osteomalacia, that is seen mostly in case of the adult, and there is inadequate matrix mineralization, whereas the next one is ricket that we see in the case of children, and the growth plate, that is epiphyses, are generally not fused in case of rickets. As you already know, from the UV radiations, you will get the vitamin D. Okay, from in the skin, from the 7D hydrocholesterol, we'll get the vitamin D, and either from the endogenous sources or exogenous sources as cheese, fish, milk, will get the vitamin D. This vitamin D, in presence of 25 hydroxylase in the liver, is converted to 25 hydroxycholecalciferol, which in presence of 1 alpha hydroxylase enzymes in the kidney is converted to 1,2,5 dihydroxycholecalciferol, which is the most active form of the vitamin D. Okay, and as we know that the parathyroid hormone, what does it do? It increases the activity of 1 alpha hydroxylase in the kidney and leads to the formation of 1,2,5 dihydroxycholecalciferol. Okay, and this cholecalciferol, 1,2,5 dihydroxycholecalciferol, also known as calcitriol, what does it do? It helps in calcium absorption and it increases the blood calcium level. Also, what we know is that this parathyroid hormone, it increases the osteoclastic activity and it inhibits the osteoblastic activity. Okay, and overall, what is the main function of vitamin D? Helps in bone mineralization, metabolic function, and also in case of neuromuscular junction, it maintains the integrity. Okay, is it clear? यो rank ligand को कुराहरु पनि छ हैन यो rank ligandहरु चाहिँ के हुन्छ त भन्दाखेरि parathyroid hormone चाहिँ osteoblastलाई चाहिँ stimulate गर्छ के parathyroid stimulates the osteoblast. Okay, and it stimulates the secretion of this RANK rank ligand, but यो rank ligand को receptor फेरि osteoclast मा हुन्छ के. So that what happens is that when this rank binds with the rank ligand, osteoclast get activated र bone resorption गराउँछ. यसरी प्याराथाइरोइड हर्मोनले चाहिँ गराउँछ. मैले यहाँ तिमीहरुको लेभललाई त्यति डिटेल नचाहिएला भनेर चाहिँ मैले एक्सप्लेन नगरेको. Is it clear?
Yes, ma'am.
Okay. यहाँ अघिकै कुरा यहाँ written form मा छ. Okay, what are the functions of vitamin B? As it is a fat soluble vitamin. एउटा त्यो थाहा छ. Other helps in the bone mineralization and also the formation of both the flat and long bones. Other, it helps in the, it stimulates the osteoblast. Osteoblast stimulate गरेपछि के गर्छ? Bone formation गराउँछ हैन, and helps in bone development. Also helps in the deposition of calcium during bone development and maintains the adequate level of calcium and phosphorus plasma in the plasma and also helps in neuromuscular transmission. Okay, development थाहा भएकै कुरा हो. The flat bone from the intramembranous bone formation where the mesenchymal cells differentiate into osteoblast, and in the long bone by the endochondral ossification. And ultimately, there is the formation of osteoid matrix which undergoes mineralization and forms bone. Is it clear? अहिलेसम्म पढाएको बुझ्या छ?
Yes, ma'am.
Okay. Regulation में क्या होता? Hypocalcemia. At first there is hypocalcemia. How? Due to vitamin D deficiency. Na? Hypocalcemia. What does it do? When there is a decrease in the serum calcium level, it stimulates the parathyroid hormone. Okay, which act on 1-alpha hydroxylase and helps in the formation of calcitriol. So, अघि figure में भनेको कुराहरु छ, that helps in calcium absorption. Likewise, parathyroid hormone increases the osteoclastic activity. So, how it increases the osteoclastic activity? By it increasing the calcium reabsorption from the bone and mobilizes the calcium from the bone. So, एउटा calcium reabsorption increase गराउँछ, it decreases the renal calcium excretion and increases the renal phosphate excretion. Okay, and in this way, the vitamin D deficiency is regulated by hypocalcemia. Hypocalcemia हुने बित्तिकै प्याराथाइरोइड हर्मोन एक्टिभेट भएर प्याराथाइरोइड हर्मोनले चाहिँ रेनल 1-alpha हाइड्रोक्सिलेज किडनीमा भएको 1-alpha हाइड्रोक्सिलेजलाई एक्टिभेट गरेर क्याल्सिट्रायल बनाउँछ, that helps in calcium absorption. Similarly, अर्को ओस्टियोक्लास्टिक एक्टिभिटीबाट क्याल्सियम रिएब्जर्प्सन गराउँछ र रेनल क्याल्सियम एक्सक्रिसनलाई चाहिँ घटाउँछ र रेनल फस्फेट एक्सक्रिसनलाई बढाउँछ. Okay? Likewise, when there is the phosphate level, the plasma level of the phosphate when becomes low, it also impairs the bone mineralization. यो सबै के को consequence भन्दाखेरि vitamin D deficiency भएपछि है. Vitamin D deficiency हुने बित्तिकै serum calcium level पनि low हुन्छ, phosphate level पनि low हुन्छ र bone mineralization मा hamper गर्छ. बुझ्यो यो?
Yes, ma'am.
Okay. So what are the etiopathogenesis of vitamin D deficiency? Either there may be inadequate synthesis or the deficiency of vitamin D in diet. How? If the person is not being exposed to sunlight, if there is a limited intake of fortified food, if the mother is not getting the proper nutrition, and also in the conditions as dark skin pigmentations, okay, there is inadequate synthesis or dietary deficiency of vitamin D. Or there is, if the conditions associated with the decreased absorption of fat soluble vitamin, as vitamin D is fat soluble, when there is the decreased absorption, also leads to conditions as osteomalacia and rickets. Okay, but what are the conditions associated with the decreased absorption? It may be cholestatic liver disease, pancreatic insufficiency, or celiac sprue, small bowel disease, biliary tract obstruction. Just remember some of the name. Okay, either there should be inadequate synthesis or decreased absorption, or be the problem in the metabolism of vitamin D, or at first there may not be the impaired synthesis of 25-hydroxycholecalciferol, or there may be the decreased synthesis of 1,2,5-dihydroxycholecalciferol, advanced kidney failure or kidney diseases. Okay, or even if there is congenital deficiency of renal alpha-1 hydroxylase, which is also known as vitamin D dependent rickets type 1. These all conditions are associated with vitamin D deficiency. And even the phosphate depletion is also associated with vitamin D deficiency, as when there is more phosphate depletion, when there is the poor absorption of phosphate due to chronic use of antacids, okay, that binds with the aluminum hydroxide and causes absorption of phosphate in a very poor manner, or excess excretion of phosphate by the renal tubules in case of X-linked hypophosphatemic rickets. So what are the pathogenesis? If there is inadequate intake or decreased absorption, or if there is any problem with the metabolism or the phosphate depletion. In short, maybe dietary deficiency, limited exposure to sunlight, phosphate depletion, malabsorption disorder as celiac sprue, renal disorders, inherited conditions, all this lead to vitamin D deficiency. Is it clear?
Yes, ma'am.
बुझिरहेछ नि?
Yes, ma'am.
के बुझेको छैन भने भन है बिचमा. फेरि म्यामले के पढाउनु के बुझेन भन्ने होइन. बुझेन भन्ने सोध्ने. बुझेछ त्यो अघिको चार्ट बुझ्यो?
बुझेको छ म्याम.
बुझ्यो है? यो मैले यो र्याङ्क र र्याङ्क लिगेन्डको मैले त्यस्तो डिटेलमा चाहिँ नभनेको, तिमीहरूको लेभललाई त्यस्तो चाहिने कुरा त होइन. तर एकचोटि अब त्यस्तो मैले पढाएको बुझेन भने चाहिँ एकचोटि नेटमा यो र्याङ्क र र्याङ्क लिगेन्डको बारेमा हेरे हुन्छ है. तर खासै तिमीहरूको लेभलमा त्यस्तो चाहिने कुरा चाहिँ होइन. त्यही भएर मैले त्यति डिटेलमा चाहिँ नभनेको है. Okay. How is the unmineralized matrix becomes excess? यसमा चाहिँ के हुन्छ, vitamin D deficiency भएपछि के हुन्छ, फर्स्टमा क्याल्सियम र फस्फेटको एब्जर्प्सन हुन पाउँदैन. त्यसपछि एब्जर्प्सन नभएपछि the level of calcium and phosphate in the blood becomes low. Then this will stimulate the secretion of parathyroid hormone. As the parathyroid hormone increases the osteoclastic activity, it will mobilize the calcium and phosphorus from the bone into the circulation. As a result, mineralization of the bone is decreased and the excess of unmineralized bone is seen. Right? Etiopathogenesis ma chai, if etiopathogenesis is asked, you can mention these slides, and after that this one, pathogenesis. Okay, is it clear?
Yes, ma'am.
Yes, ma'am.
Okay, now coming to rickets, the normal level of 25 hydroxycholecalciferol is 20 to 100 nanogram per ml. If it is less than 20 nanogram per ml, we consider it to be vitamin D deficiency. The causes are same as when there is a deficiency of calcium and vitamin D in diet, limited exposure to sunlight, renal disorders, malabsorption syndrome, and phosphate depletion. So, in both the cases of rickets and osteomalacia, we'll have an unmineralized bony matrix in excess of amount. And what occurs in case of rickets? In the rickets, the epiphyseal cartilage increases, okay? And there is a failure of this epiphyseal cartilage to mature, okay? And likewise, also there is the presence of distorted irregular masses of cartilage that projects into the marrow cavity, and unmineralized matrix or unmineralized cartilaginous remnant becomes excess, and there may be the replacement of the cartilage in a very the organized forms being disrupted, okay, so that we can see the protrusion, lateral expansion of the osteochondral junction. Even the capillaries and fibroblasts may be disorganized in such area, so that it makes the bone prone to microfractures in response to any small stress also, okay. So the inadequately mineralized bone are formed, and also this leads to the loss of skeletal integrity, okay, because there is not proper growth of the fibroblast and capillary supply to those areas, so that the bone is prone to fractures and also lead to deformity. What are the signs and symptoms? In the first year of life, it depends upon the severity and duration. In the non-ambulatory stage of infancy, mostly the changes are seen in the head and the chest area. The occipital bone are softened and they become flattened. Similarly, we will see craniotapes. What does that mean is that the parietal bone sustains the pressure and it is pushed inward, okay? And with the release of pressure, elastic recoils occur, okay? And it returns back to its original position. That is craniotape. Similarly, excess of the osteoid leads to frontal bossing and the head becomes square shaped. Okay? And the next condition is rachitic rosary. It is the one of the condition of chest deformity due to excess of cartilage or osteoid tissue production at the costochondral junction. Similarly, there may be the protrusion of the sternum with the inward bending of the lower part of the chest. Okay, that is pigeon breast deformity or pectus carinatum. And even the diaphragmatic region may be pushed inward, leading to the formation of Harrison groove. And mostly this rickets is seen in ambulatory child, and later the child may even have the bowing of the legs and deformities of the spine, pelvis, and via. Okay. Mostly the chest and head is involved. The occipital bone are very soft and becomes flattened. Craniotape seen in the parietal bone, where the parietal bone sustains the pressure and is pushed inward. And on the releasing of the pressure, it can recoil back to its normal position. That is known as craniotapes. Square-shaped head with the excess of osteoid produces the frontal bossing. And also in the rachitic rosary, there is the overproduction of the cartilage in the costochondral junction that leads to the deformed chest. And also the pectus carinatum, where the anterior protrusion of the sternum with the inward bending of the lower part of the chest, okay, giving a pigeon breast deformity. And the last one is Harrison groove. Tunnel, delayed closure, wide sutures, okay, craniotapes, as already mentioned, rachitic rosary, Harrison sulcus in the inward pull of the diaphragmatic groove, pectus carinatum, the sternum becomes protruded, and also the bowing of the legs and the knee and ankle joint are swollen. Okay, is it clear?
Yes, ma'am.
Yes, ma'am.
Okay. So, bow like a bow, there is the bending of the legs. Normally rickets मा चाहिँ normal child मा चाहिँ के हुन्छ त भन्दाखेरि यता कार्टिलेज छ नि हैन, कार्टिलेज इज कार्टिलेज को orderly transition from the cartilage into the bone हुन्छ है. But in case of rachitic rosary or in a child with the bowing legs, what happens is that these are all the well formed bony trabeculae, but these are all the uncalcified osteoid. Okay, and there is not the proper transition from the cartilage into the bone, so resulting in the formation of bowing of the legs. There is a poorly formed, poorly mineralized bone, so it leads to the bowing of the legs. Yes, बुझ्यो?
Yes, ma'am.
सबैले बुझिरहेछ नि?
Yes, ma'am.
Okay. Now coming to the osteomalacia, mostly in the adult, inadequately mineralized osteoid matrix is abundant, and but the bony contour, there is no such deformity seen. Okay, there is a persistence of the osteoid which is unmineralized, and it mostly occurs in the adult. So the patient may present with the microfractures or the pseudofractures, mostly in the vertebral bodies and the femoral neck, and that is also known as the milkman loser syndrome or the pseudofractures. And other complaint may be muscle ache, pain, weakness. Only this kind of features are seen. How does an unmineralized osteoid looks on histopathology? It appears more pink and are arranged in between the mineralized bony trabeculae. Pinkish area धेरै देखिन्छ. Pinkish area भनेको unmineralized osteoid हो, which appears more in between the bluish area भनेको mineralized bony trabeculae. Few bony trabeculae appears mineralized. Most of them are unmineralized, which appears pink. Mineralized bony trabeculae चाहिँ blue हुन्छ है. And what are the changes? There's a low level of vitamin D. Both the 25 hydroxy and 1,5 dihydroxy cholecalciferol level is low. The serum calcium level may be normal or low. Serum phosphate level is low, but the alkaline phosphatase is increased. Alkaline phosphatase increases here as a result of compensatory increase in osteoblastic activity that leads to the increase in alkaline phosphatase. Coming to the toxicity, when a person is being prolonged exposed to sunlight, it does not produce any toxicity. Okay, but in case of the children, hypervitaminosis D occurs in the soft tissue, which appears as metastatic calcification. Okay, when the vitamin D level is increased, then it leads to metastatic calcification in the soft tissue as kidney. But in adult, it causes bone pain and hypercalcemia हुन्छ. Vitamin D level बढ्ने बित्तिकै त calcium level पनि बढ्ने भयो नि त. So that the patient may present even with bone pain in case of hypercalcemia. Is it clear? एकैछिन है, मेरो फोन आइरहेछ. के भयो? Hello? 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 Are you guys there?
Yes, ma'am.
बुझिरहेछ? मेरो फोन आयो के इन बिट्विन हस्पिटलबाट, अनि त्यही भएर. बुझ्यो मेरो कुरा? यो रिकेट्स र ओस्टियोमेलेसिया बुझ्यो?
Yes, ma'am.
केही छ क्वेसन नबुझेको?
No, ma'am.
के सोध्नु पर्ने छ? के बुझ्या छैन त्यस्तो केही?
छैन म्याम.
Okay. त्यसो भोलि विल बी स्टार्टिङ द एड्रिनल ग्ल्यान्ड. दिस मच फर टुडे हुन्छ. बुझ्यो नि रिकेश रोस्टिमेलेसँग के पनि क्वेसन छैन नि त्यसो भए.
No, ma'am. Thank you, ma'am.
ओके यु मे लिभ. ओके यो स्लाइडहरू अरू म्यामहरूले दिनुहुन्छ. ए ओके केमा पठाउनु त. ए ल ल. एटिन्थ MBBS म पठाइदिन्छु है.
Thank you, ma'am.
ओके बाई.